Hello students, am I audible?
Yes,
Yes, ma'am.
ma'am.
Okay, good afternoon everyone.
Good afternoon, ma'am.
Good afternoon.
Okay, I'll be starting with burns, okay? Then that classes I have
Yes,
given you
ma'am.
definition and the depth of burn I have given, extent of burn and then classification, right? Yes?
Yes, ma'am.
Yeah, slide is it visible, the slide?
Yes, ma'am.
Okay. So this one we have written no definition. A burn is a type of injury to the flesh or skin which can be caused by heat, electricity, chemicals, friction or radiation. Yes? This one you must have written that day.
Yes, ma'am.
Then
Yes,
extent of
ma'am.
burn also you have written. This is rule of 9. Then depth of burn, the degree, first degree, second degree and the third degree. Okay? Then classification of burn injury. Classification of burn injury, that also I have completed that day, right? Yes?
Yes, ma'am.
Then rule of 9. Rule of 9 you understood? Understood or not this one? Percentage?
Yes, ma'am.
Head and neck is 9%. Okay? Anterior trunk 18%. Posterior trunk 18%. Arms 2 into 9, that means both sides. Legs same way 2 into 18. And the perineum is 1%. This one is calculation of burn injury according to the rule of 9. Hope you are clear now. Then this is extent of burn. Then depth of burn, first degree burn. First degree if it is, it affects only in the outer layer of the skin, and if it is second degree then it will be both outer and inner layers of the skin, and if it is third degree it will be full thickness burn, both dermis and epidermis. Okay, then another one is Palmer method, that with a pump it is for small burns we can estimate the percentage. Patient's palm including fingers is equal to 1% of their total body surface area. Then another one is there, three things is there, three types. Another one is Land and Browder chart. You from here I think I have to start. You please write this one. It's visible I think now.
Yes, ma'am.
Please write, huh?
Ma'am, done.
Now pathophysiology of burn. Pathophysiology of burn means what are the alteration that takes place due to burn. Those things second year will be studying, okay, and means all burns, how to manage, how to calculate, but this is for first aid, but that's why I have given in short, okay. So pathophysiology of burn here, the cardiovascular alteration, that means it affect the cardiovascular system, fluid and electrolyte alteration, that is the very important part, and that's why immediately we have to correct the fluid, we have to start IV fluid. Then pulmonary alteration, it affects the lungs. Renal alteration, since it is a fluid electrolyte imbalance, obviously it will affect the renal system. Immunological alteration, patient will be more prone to infection for burn patient, okay, because it affects the skin layers. Then thermoregulatory alteration, that will be there. Patient will not able to maintain the body temperature. Then gastrointestinal alteration, then metabolic alteration. So these are the alteration takes place due to burn. Diagnostic evaluation of burn. History taking, physical examination, diagnostic test, complete blood count, then ABC analysis, human chorionic gonadotropin testing, serum urea, electrolytes, chest X-ray, CT scan, laser Doppler imaging. These are the diagnostic tests have to carry out for burn patient. Done?
Yes, ma'am. Yes, ma'am.
Sign and symptoms: red raw skin, blister formation, swelling, oozing fluid, intense pain. Burn severity assessment. How we can, first we have to find out the extent of burn, depth of burn. Then we will be knowing about the percentage. Now minor, moderate and major, the severity of the burn, how we can find out. First we will take out the percentage. Okay, after percentage, based on percentage we can find out. So if adult is less than 10% of the total body surface, it will be minor. Younger or old, if it is same, less than 5% total body surface, and less than 2% of full thickness burn, all these three categories comes under minor. Same way for moderate and the major. So before finding the severity of burn, first we have to find out the percentage. That percentage we can find out according to the rule of 9, Palmer method, and then London Broader chart. After finding out the percentage, we can find out the severity of burn. Done?
Ma'am, done.
Next is first aid treatment. So these are the, we have discussed so far what is the burn definition, then the sign symptoms, then depth of burn, extent of burn, then severity of burn, how to assess, then classification of burn. Now, what are the first aid treatment? What we have to do? First aid for first degree burn. Stop the burning. Remove the victim from the source of the burn. Next, cool the burn area with cool running water. Use sheets or towels soaked in water to cool a burn on the face or other areas that cannot be soaked. Then wearing gloves, loosely cover the area with dry, sterile bandages. Second degree burn, partial thickness, a burn that involves the top layers of the skin. Then blisters from and may discharge clear fluid. Skin appears wet, blotchy, heals within 2 to 4 weeks, may have slight scarring. This after burn, no, the scar always used to be there. So we have to be very careful. What are the foods we have to avoid and what are the medicines, that ointments we have to use, because scar always used to be there. Of course, after that we can use the ointment so that the scar will go. Done?
Yes, ma'am. Yes, ma'am.
Third degree burn, full thickness, a burn that involves all the layers of the skin and some underlying tissues, fat, muscles, bones and nerves. Next is chemical burns. It occurs when something caustic, such as cleaning product, cosmetics or anything like that. Okay. Bleach, ammonia, bleaching also we used to do or not? Bleach, sometimes you heard or not, few months back, one lady, she went to beauty parlor and full face it was burned. Have you heard this incident?
No, ma'am.
Yes, ma'am.
It was in Assam only. Okay. So like that type of thing. So we have to be very, very careful. Then household and garden products, fertilizers, gasoline is splashed into the skin or onto the skin. It is important to read all product labels carefully. Follow this home treatment for chemical burns in the skin. Sometimes we used to take herbal things also we are taking. We used to see always Google and then we'll see, we'll use. No? So those things before using we have to be very, very careful. Okay. Then wash the area with large quantities of water for at least 20 minutes. Remove any contaminated clothing during washing, because if it is contaminating cloth or anything will be contaminated, then definitely person will get the infection. That is very, very careful because it affects the skin layer. So entry of microorganisms is very easy and it will lead for infection. Otherwise too, patient will get dehydration and patient immunity also it will lose and then more prone to get infection. So we have to be very careful. Infection and dehydration is the main two things that occurs for burn patient. Cover the burned area with a sterile dressing to avoid infection. If at home you may not have the sterile dressing, right? So we have to take the very clean cloth. Then seek medical help if there is a major skin exposure, more than 1/4 of any of the part of the body or on the face to a strong acid, such as battery acid. For chemical burns in the eyes, follow these procedures for home treatment. Immediately flush the eye or skin with water. If the eyes are involved, fill a sink or dish-pan with water. Immerse the face into the water and open and close the eyelids to force the water to all parts of the eye. You may need to open and close the eyelids with the fingers or flush the eye under a running faucet or shower. Continue flushing for 15 to 20 minutes or until the pain stops, whichever takes long. After flushing, cover the eye or skin with a clean bandage or cloth. Seek medical help if the eye still hurts after 20 minutes of home treatment and if their eye appears to be damaged. Electrical burn, electrical injuries are devastating. It shows if you see the burn patient, by electrical burn, you cannot see from the outside. Okay, outside is not that much visible, but it is more dangerous than the other burn. Okay, even with just a wild shock, a victim can suffer serious internal injuries. It may not be from the external, but is internal, it is serious injuries. A current of 1000 volts or more is considered high voltage. but even the 110 voltage of household current can be deadly. It's very, we have to be very careful. Burns of the eye. Wash the eye with plenty of cold water. Wash face also with plenty of cold water. Do not rub the eyes. Do not use any ointment. Cover the eye with clean dressing and send for medical examination. Next is at last this one, how we can prevent burn. Prevention is always better. So prevention of burn. Ovens and stoves should be kept at a higher level, about 2 feet above the ground. While working near fire, see the cloths and are not hanging free or flapping about. Never go near fire when wearing material made out of nylon or similar fibers, as these cloths catch fire easily and quickly. These all things is very common, we know. Never put kettles or other vessels with hot liquid near the edge of the stove or sink, etc. Never leave children alone in a room where there is a fire. Keep matches out of the reach of children. Do not hang cloths near the open fire. So we have discussed about what is burn. Definition: a burn is a type of injury to the flesh or skin which can be caused by heat, electricity, chemical, friction or radiation. Etiology: thermal injury, electrical injury, chemical burns, and coal injury, ionizing radiation, and the sunburn. Then extent of burn: this is head and neck. This extent, rule of 9. Depth of burn, the degree of burn. Okay. Classification: yes, we can divide into, one is extent of burn, another one is the depth of burn. And the extent of burn, there will be rule of 9, learned and browser chart, and the Palmer method. This is rule of 9. This one for children and even adult both. And then this is Palmer method, and another one is this is learned and browser chart. Then after that, pathophysiology, how it affects the human body. Okay, what are the system it affects. Then diagnostic evaluation of burn. What are the diagnostic tests we have to carry out. Then sign and symptoms. Sign and symptoms again for other things also will be there. Okay, these are the signs. Other things will be like for dehydration, infection, all those will be there. Then burn severity, if it is after the percentage, taking out the percentage, if it is minor, moderate and major, we can divide it based on the percentage of the burn. Then what we have to do it here, only the first stage. So what we have to take out, remove victim from the source, then cool the area. Then if it is anything, a cloth or anything is attached with that area, so we try to take out and use the clean cloth. And then if it is not able to manage at home, we have to send it to the hospital. We have to see how severe it is. And then fluid is important. Of course, we have to prevent the dehydration. So if patient can, then we can give orally fluid. Okay, that is important. Then if it is chemical burns, so what are the, how it can take place, what we have to do. If it is home treatment, we have to use the this water, only cold water we can use. Okay, and then if it is after 20 minutes also, if you see if it is means there is no anything recovered, still pain persists, then we have to definitely send it to hospital. And the electrical burn, and we cannot see the external injury, so we have to shift the patient to the hospital immediately. Then burn of the eye, yes, this one always we are using, if anything is there inside the eye, always used to use the cold water. Then prevention of burn. So these here we are discussing only about the first aid. That's why we are not going inside what we have to do. Okay, we are only discussing about the first aid, what we will do it. So second year you will be learning, so that's why it will be easy for you how to classify the burn. Okay, easy. Only the things here we are not asking about you the management, because management will be doing in hospital. So that will not be the first aid. But in the first aid, what we can do, take out the victims from the source. Then we have to how to transfer the patient if it is not able to manage at home. If it is, then we can use the cold water that we are using. Okay, and then we have to one more thing. It's not it is not in the slide, but you remember always fluid. Correction of fluid is very important. Okay, that is important, and the prevention of infection. That two thing is very important for burn patient. Even though if you measure taking at home also. Okay. Then after that we have to shift the patient to the hospital, and in the hospital we will be using the fluid correction, that Parkland formula. How much fluid we have to give, those things it will come the advanced treatment, that will be in the hospital part. Okay, understand?
Yes, ma'am.
Yes, ma'am.
Okay, okay then. For today I have completed this topic burn, and the one more topic only left for me that I will be taking tomorrow. Okay?
Okay, ma'am.
Okay, ma'am.
Okay, then bye bye, huh? I'll see you tomorrow again.
Yes, ma'am.
Okay, then bye, huh?
Okay, ma'am.
Bye bye.
Bye, ma'am. Thank you, ma'am. Thank you, ma'am.